Good morning, everyone. We'll get started in just a minute. Feel free to put change your name on your screen if you want to. And as we get going, if you have questions, feel free to put them in the chat box or turn your camera on, come off mute and raise your hand and we'll acknowledge you. But we'll give it just another second. We've still got people joining. So welcome everyone to the June Partners Community Cafe. Today we will be discussing Tailored Plan. I really love seeing all the people here. And again, we welcome you to turn your cameras on if you want to, but we respect if you can't. So with that, we are going to go ahead and get started with today. Our first speaker is Mr. Brett Ackerman. He works in Iredell County for the United Way. And Brett, I'm going to allow you to do any more formal introductions of yourself, but welcome and thank you for being here, Brett.
Thank you, Jerry, and good morning, everybody. As Jerry mentioned, it's my great honor to be the Executive Director of the United Way in Iredell County, which gives me a wonderful position to get to see incredible work that goes on at nonprofit and for-profit partners across the community to serve people. Last year, we worked with over 60 nonprofit partners in some way, shape, or form, focused in on the education, income, and health of every person in Iredell County. Jerry asked me to come on and talk a little bit about social determinants of health. And I always get just a little bit of a sour look on my face when I say the phrase social determinants of health. And I guess where that comes from is it's a kind of buzzy term right now. You hear it an awful lot, but it's a really old concept. The basic concept is that the environment surrounding an individual matters to what their outcomes, health outcomes, income outcomes, education outcomes are gonna be. And from the health and human service side of things, we've been telling doctors and hospitals that for a really, really long time. And so it's nice to see them starting to catch up. But at the same time, it feels like we've been beating on that drum for a while. One thing I want to focus my time on a little bit today is peeling back a little bit about social determinants of health and the interaction between those two. So I'm going to change that definition of social determinants of health up just a little bit and say that it's not just any one aspect of that environment. A lot of times what you get focused in on is hunger impacts health. Well, obviously, hunger impacts health. Hunger also impacts educational success. Hunger also impacts financial success, the ability to keep a job. Housing impacts health. Well, obviously, the environment you're living in, if you don't have a safe place to lay your head at night and you're not able to sleep, that will impact your health. That'll also impact your education. That'll also impact your ability to hold a job and be economically successful. So to illustrate my point a little bit, what I'd like to do is share a recent compilation I was asked to put together of community needs assessments in Iredell County. Now, this is for Iredell County only because that's the area we serve, but you could do exactly the same operation in any of the counties partners serve. And with the exception of a few different words in a few different spots, you would end up in almost identical places. So we did a quick review of 6 different assessments that have been done over the last couple of years in Iredell County and looked at what are the key takeaways? What are the areas they said we need to focus in on as a community to really leverage results? And you'll see there's a bunch of words on the screen. There's some words that show up more than once. Early childhood education shows up multiple times. Affordable housing shows up multiple times. And these are helpful exercises. They're helpful exercises to try to find a leverage spot. Because the truth is the ball of yarn can be daunting and overwhelming to try to figure out how do we make a difference. But as you start digging into any one of these issue areas, I think what you'll find is that they're all interrelated together. It's not by moving the needle on any one of these issues that we're going to change a family's trajectory completely from the cycle of poverty, the cycle of health issues, the cycle of housing issues, any of those things we can get caught in a cycle to a cycle of success, a successful, thriving family that's moving on several levels. When you really start looking at program level difference, it's that amalgamation of the programs working together where you start to see families really change their overall situation, not just any one of those alone. So that leaves us with a blessing and a curse. Let me just put it that way. The blessing of that knowledge is that there is no wrong place to start making a difference. That any one of these things you start making better is going to improve the overall situation. The curse is that there's no easy answer to moving a community, a family towards a thriving situation. You have to look at the holistic situation that's going on and start to figure out how you bring multiple partners together to make a difference. I think Jerry wanted me to bring that forward because we're going to focus in today on several program level moves and changes that are going on. And he wanted me just to foreshadow a little bit the importance of looking at the whole picture as you start looking at these individual changes and shifts. Jerry, anything else you wanted me to cover that I did not, or any questions I could answer from the group?
I think it's a good time to pause and see if there are any questions related to what Brett discussed and social determinants of health.
Hey, Brett, it's Rob. On the priority issue number 4, you have listed shifts in funding landscape. Can you hit on that a little bit?
Yeah, so COVID was very disruptive to every aspect of our communities. And included in that is the nonprofit sector. All of a sudden, there was a lot of funding coming down the pipeline in a hurry to ramp up services in an emergency way. And then that just cut off. And so a lot of nonprofits got caught in a cycle of ramping up services and then having to close down those services. And it's led to disruptions in our ability to serve clients. There's a continuing level of need that there's a gap between the continuing level of need we're experiencing as service providers and the continuing level of funding that's being provided to meet that need. And there are an awful lot of nonprofits right now that are getting caught in that mix without the ability to adjust over a period of time, but to really have to ramp up quickly to try to serve the communities. Any other questions?
Thank you so much, Brett. Are you able to stay on in case there are questions a little later?
Of course, and I'm around all the time. So anybody that has follow-up questions, please feel free to give me a call. You can find me United Way of Iredell County, uwiredell.org.
Thank you very much. And we will share the document that Brett mentioned and posted. We will share that after the cafe with everyone here. Our next speaker is Mr. Ben Mace with Kintegra. And Ben is going to be talking about the importance of whole person health. Ben, I am going to allow you to again give your information about who you are and your role with Kintegra. But welcome and thank you for being here.
Thank you. Good morning, everyone. My name is Ben Mace. I'm the practice manager at Kintegra Family Medicine here in Hickory. And Kintegra, as a whole, is a community-sponsored, family-centered healthcare, education, and preventative care services without regard for the ability to pay. So what that means is you don't have to have insurance. You don't have to have the money in your pocket when you come in here to pay for the whole visit. We have what's called a sliding scale fee basis program, and it's based off of household income and number of people in the house. And based on where you fall on the federal poverty level, there's a tiered flat rate copay system now. We used to have different levels of percentages of discounts, but billing on the back end got a little difficult and patients would get bills in the mail. So now all you have is a flat fee copay, and that's all you pay for your visit. And as long as your paperwork's in order, if you don't have your copay, we're not going to turn you away. We'll still see you and you can pay us back when you can. And as far as whole person health goes, Kintegra has a lot of different services. We have primary care, like your family doctor. We have behavioral health. In my clinic, and just about all of the primary care locations, we have an integrated licensed clinical social worker to provide counseling. I give you short-term, long-term. If you're here for a medical appointment and you just really need to talk to someone, they can accommodate a walk-in appointment. And even if you're not here for an appointment, we accept walk-in behavioral health appointments for all of Kintegra's patients. We have a standalone behavioral health office here in Hickory, and they take care of short and long-term counseling, and they have a psychiatric nurse practitioner who can handle the psychiatric medication management. We also have a medication-assisted treatment program. We have dental. Our family dentistry office here in Hickory is at the health department. We have specialty services. We have a mobile chiropractor, podiatrist, and optometrist. And the chiropractic and podiatry come to my office once a week to see the Kintegra patients outside in the parking lot on their mobile unit. And I know what you think. It's like a little bus, but no, it's a pretty good size. They're like RVs that have been converted into a treatment space. So on the chiropractic unit, he's got a big room with a chiropractic bed to put you on and get your adjustments done. The podiatrist has 2 exam rooms on the mobile unit, an x-ray to take x-rays of feet and ankles. We have a nutritionist, diabetes educator, and they come to the office once or twice a month to see the patients. We have community resource advocates here at the office, and they can help you get linked to any other resources that you may need that go with addressing the social determinants of health. They can help you enroll in a marketplace insurance plan. They can also do Medicaid enrollments, and those are not just for Kintegra patients. Medicaid enrollment and marketplace enrollments are open to any member of the community. You can come in and make an appointment to get help with enrollment. We have HIV case management and a service called PrEP. It's pre-exposure prophylaxis, and we have post-exposure prophylaxis for HIV and Hep C. And so far, since the Hep C treatment started, we have cured, I believe it's over 600 patients now from Hep C from the service. And we partner with one of the Catawba Valley Medical Group offices, and the provider there will see you and take care of the treatments. We also have what's called Senior TLC. It's a total life care, and it's a day program for seniors, and they have primary care there, physical therapy, and a bunch of other services. So you can get everything taken care of at the location. They also do home visits, and we have a location in Gastonia and Shelby, and we now have Pace of the Southern Piedmont, which is somewhere, I think it's North Charlotte, Mecklenburg area, or Cabarrus County. I haven't been there myself, so I'm not sure exactly where it's at. we have case management. And then whatever we don't have, we'll help you get to whatever it is that you may need through the use of our community resource advocates, our referral department. We partner with the Cooperative Christian Ministry right next door to us to provide pharmacy services. Our 340B pharmacy program is like going to a retail pharmacy, except we get the medications for pennies on the dollar of what they pay, and then we can turn around and sell them to you for pennies on the dollar of what you would pay at a retail pharmacy. But here in Catawba County with CCM, you have to have no insurance. So you have to meet CCM's pharmacy eligibility to be able to get your medications there. But some of our other counties do have pharmacies in the office. And the closest ones to here is Statesville and Lincoln. And I think that about wraps it up for all of the services we provide. In the chat, I shared a link to our practice locations brochure and our website. And on our website, you can go and view everything I just talked about, our mission, our core values. There's a button to get an appointment. You can call our appointment line, and that will get you booked in for a new patient appointment here if you're not already a Contegra patient. And I'll go ahead and share my screen to show you our bifold or our trifold brochure. So when you click on the first link, this is where it'll take you. And it has our services listed on the back. And then the next page will go over all of our locations that we have throughout our 12 counties. And then you have our website, the homepage here, our awards.
Hey, Ben, we're not seeing your screen.
Oh, I guess I should hit the share button. So this is the location brochure. It has our, this is the front page because we have them in the office that are folded up physically, but on the back it has our services that I went over. And then on the inside it has all of our locations and a number to call to make an appointment. And then you have our website here with an option to call to get an appointment or book one online. And then you have, I have to minimize this so I can click on the next tab. And then we have all of our awards that we've been given. A page that lists all of our support services and programs that I went over. And then I have the page pulled up for our family dentistry office here in Hickory, and it has their number to call to get an appointment, the services that they provide, and the providers. And if you go to the locations tab, you can filter by what you're looking for: medical, behavioral health, dental, and school-based. We do have licensed clinical social workers in all of the Catawba County schools, so they can see the kids at school. And then when you zoom in to a location and open it up, you can see their contact information, their address, the services, and then you can see all of our providers here at the office. Does anyone have any questions for me?
Ben, I believe you covered it, but there was a question in the chat about location as far as services in Forsyth County.
What's the city in Forsyth?
Winston-Salem.
So in Winston-Salem, we don't have any clinics, but we do have some school-based services. Like this one, Contegra Shaw at Winston-Salem Prep. On the location here, it lists medical and behavioral health services, but the closest clinic to Winston-Salem is Contegra Family Medicine in Moxville, Lexington, or Thomasville, based on where you live. And then we have, if you live like closer to Greensboro, we have an office over in Asheboro. And I know in Asheboro and Thomasville and Lexington, our mobile services, like our chiropractor and podiatrist, they go there as well.
Ben, to that note, since you're saying there is not a Contegra facility in Forsyth, but there should be an FQHC that's equivalent, correct, in Forsyth County?
Most likely, and that's probably why we don't have an office there, because we do not like to duplicate services. We only go to where we're invited, so you won't see a Contegra popping up just anywhere. There has to be a need, and we have to have community support and endorsement to apply for what's called a federal access point grant. And there's only so many per year, and you're not always guaranteed to get it. So it's a little difficult to just make a new Contegra. We have adopted private offices in the past. Last year, the office in Asheboro was another federally qualified health center called Mercy. And it's the first time an FQHC has ever adopted another FQHC in North Carolina. Over in Cleveland County in the year prior, we adopted an organization called CLECO, and they had 3 or 4 primary care offices, and they're now Contegra. And then there was a private office in Shelby also that we adopted. And then our Lincolnton office started off, I'd say 20 years ago, maybe. It was originally a free and charitable clinic. It was called Helping Hands. And we worked side by side together, and then we worked together, became one. And then slowly throughout the years, it transitioned from a free and charitable clinic to a federally qualified health center.
I'm not Google and I don't play one on Zoom, but I did look up real quick to see if I could find an FQHC in Winston, and it looks like a United Health Center might be the place for whoever was looking for those services. I put it in the chat.
And if
Okay,
you
so
go farther west in the state, there's another large FQHC like Buncombe County and west called Blue Ridge, I believe. Another larger FQHC like us that provides similar services.
Thank you very much. And actually, I do note that we've got at least one other FQHC, High Country Community Health, that's on the call today with us as well. Thank you so much. Are there any other questions for Ben before we transition?
I wanted to ask Ben, you mentioned the dental. Is that for just the people that come in through Contegra, or can anybody that has Medicaid or whatever use your dental facility?
Yeah, dental is open to everyone. You don't have to see us for primary care to see dental. And as far as insurance goes, we exist and we were created to help those that are non and underinsured, but we accept all insurances, Medicare, Medicaid, private, marketplace. We take them all. The only exception to that is whenever there's a new marketplace plan, it takes us some time to get contracted with them. So at the beginning, we'll be out of network, and most marketplace insurance plans don't have out of network coverage. But our billing department will speak with our credentialing, and if they're in the process of getting in contract, they will hold your bills until we are in contract, so you don't get stuck with bills that you shouldn't get.
Do y'all have vision also?
Yes, we do have an optometrist. There is an optometrist in a clinic in Gastonia, and then we now have a new mobile optometry unit. And currently, they come to our clinic once a month, and right now they're only doing diabetic retinopathy screenings for our patients. And then during the school year, they're going to be going to, I think it's between 30 and 60 something schools across all of our service area to see children at school, and they'll actually be able to make glasses for the kids on the unit. And then as time goes on, it will grow to most likely doing regular vision exams for patients, but they'll only be able to make glasses for children.
Okay, thank you.
Mm-hmm.
Thank you so much. And Ben, are you able to stay on in case there's any other questions as we close? Thank you very
I'll be here.
much.
Thanks,
And
everyone.
we will share Ben's information as well when we send an email out as well. Thank you very much. We are now going to transition to Miss Regina Haynes. She works for Partners Health Management as well, and she is going to talk about the Healthy Opportunities Pilot that we are doing. Welcome, Regina. Oh, you're muted.
I was. Thank you, Jerry. Good morning, everyone. It's good to be here today, and thank you for taking time out of your day to hear our presentations. I'm going to share my screen. I am Regina Haynes. I'm the Healthy Opportunities Program Manager here at Partners, and so I'm going to share my screen, which has a PowerPoint that will go over the highlights of the Healthy Opportunities Program. Okay. Now if I can get it to do what I want it to do. There it is. Okay. So the Healthy Opportunities Pilot is it's a federally funded program that provides non-medical services that are not covered by Medicaid to eligible members. Can y'all hear me? My screen just went weird.
We can hear you.
Okay, can you? Okay. The goal of the pilot is to, or the program is to address the social needs of members to improve the health and well-being of our Medicaid, of the Medicaid population members. It's only available right now in select counties in North Carolina, and for Partners, it's only available right now for Burke and Rutherford counties. It will be evaluated to see if it can be expanded or will be expanded in the future. So for Medicaid Direct, the Healthy Opportunities Pilot launched on actually it was May 15th. And it will expand or launch to Taylor Plan members, members receiving Taylor Plan on July 1st. To qualify for Healthy Opportunities, the member must be enrolled in either North Carolina Medicaid Direct or Taylor Plan beginning July 1st through Partners and be eligible for tailored care management. Individuals must live in Burke or Rutherford counties, which are the two counties under Partners that are in the pilot. The eligibility criteria for Healthy Opportunities is that members must have at least one of the following physical or behavioral health conditions. Adults with 2 or more chronic conditions such as mental health, mental illness, intellectual developmental disabilities, traumatic brain injuries, diabetes, blood pressures. Those are some of the conditions. Pregnant women at risk for complicated pregnancy, such as low birth weight or high blood pressure. Children ages 0 to 3 years old who have been in a neonatal intensive care unit. Children ages 0 to 20 that are experiencing or have experienced 3 or more childhood adverse childhood events. And then the members, of course, have to meet tailored care management eligibility. Again, they have to have at least one qualifying physical or behavioral health condition. IDD or TBI is for all age groups. Medical criteria, medical clinical criteria for tailored care management is for all age groups. Cancer and autoimmune diseases for children ages 0 to 20. And then importantly, individuals have to have at least one social risk factor, which are in 4 different domains right now: health and homeless and housing insecurity, food insecurity, transportation insecure, and then members who are experiencing or have experienced interpersonal violence or have interpersonal safety concerns. Some of the pilot services that are offered under Healthy Opportunities are listed here. There's 29 total right now. These are some of those: safety inspections, for move-in services into housing, essential utility setup. The pilot offers security deposits for first month's rent, some post-hospitalization housing. It pays for healthy home goods, nutrition classes, food services, medically tailored meals or food prescriptions, interpersonal and interpersonal interventions in safety or toxic stress, health-related transportation, not necessarily health transportation that's covered under Medicaid, but other transportation that relates to individuals' health, and then health-related legal supports. These are some of the services that are covered. There's no wrong door to receive Healthy Opportunities services. A member can receive those services by speaking with their tailored care manager. They can request a referral through their provider. A family or a caregiver can contact us and make those referrals. The member themselves can refer just by calling our Partners Access to Care line. Providers, whether it be medical providers or other providers that a member has, can make those referrals. And then we also accept members through transition of care. So members who are moving from one county to another into one of our pilot counties, we will assess those members for continued services or initiation services. The contact information for the Healthy Opportunities is this is my name, Regina Haynes, and my phone number. And then Danielle Sigmund is our Healthy Opportunities pilot specialist. She can be contacted, or anyone can email us directly to our HOP email address at hop@partnersbhm.org. And then, of course, by calling the Access to Care line, you can also request services that way.
Thank you so much, Regina. Are there any questions for Regina?
Trying to unshare here. Okay. Thank you.
Thank you so much. And Regina, are you able to stay on in case someone has a question near the end?
Yes.
All right, thank you. So if you think of any questions you have for Regina, Ben, or Brett as we move to our next speaker, please put them in the chat box and we will get to them. We do see a few questions in the Q&A and we will come back to those as well. But I did want to move forward and welcome our next speaker, Mr. Jackie Copeland. He is Regional Director of Community Operations for Partners Health Management. Jackie, I will turn it over to you, sir.
Thank you very much, Jerry. Can everyone hear me appropriately? I had a little, good, I'm glad to see the head nods. I had my Bluetooth decided to go out, right? As Regina finished her presentation. Great job, Regina. So again, my name is Jackie Copeland. I'm the Regional Director of Community Operations of one of four that we have, five we have. I have the counties of Forsyth, Davie, and Davidson counties. One of the things that I also have the opportunity to serve on this department, the Community Engagement Department, and I also work with, you see our host, Amani Pagis. I work with her. She is on our team of people who do community trainers, and I work with that group, supervising them. They do a phenomenal job, and I'll mention them a little bit. I've been asked to talk a little bit about tailored plan and how it affects on the community level. One of the things off the bat that we're really excited about is Partners now has the opportunity to serve the entire person, the whole person, not just the behavioral health side, but the physical health side. And we've done a little bit of that over our past, but now it gives us opportunity to manage that care. And we're excited about that because it allows us to really work with our community partners to really see how we can address the various issues and get not only deal with the physical and mental health issues, but also how do we move to a well-being. Some of the points that was mentioned earlier about just social determinants of health, or some former North Carolina Department of Health and Human Service Director, Dr. Mandy Cohn, referred to them as social drivers of health, how we can get to the point we're helping those Taylor Plan Medicaid members really tap into ways to not only just deal with them, address issues when they're sick, but how do we also work with them to help them stay well? So we're excited that we'll be given that opportunity to really address that. One of the things that we've been doing to prepare for this is having meetings like this and partnering with various groups in our communities to help do that. As Ben talked about earlier, some of the work with the federally qualified health centers, we've been engaging them. They will be part of our physical health network. One thing we've done that maybe you're probably aware of, but allow me to mention again, is we've partnered with a CCH, their statewide physical health provider, and we're tapping into their network of providers that become our network of providers. So we're really excited to work with them. But as I mentioned, the federally qualified health centers, they serve some of the same individuals that we have been working with, and they're in our network. So we're excited about some of the things that they can do. Again, working alongside them and others like our health departments, Department of Social Services, adult probation and parole, the school systems, just ways that we can now integrate with them and look at how we can serve the entire person. Again, back to the social drivers of health, how do we also help them to address, as Ed mentioned, people, housing, food, transportation. One of the things that Taylor Plan is offer some members non-emergency medical transportation, which is something new for us, and we're excited to have that roll out to them and to be offered. Again, if I may, I'm going to try to share. I'll keep your fingers crossed, but that you'll be able to see I'll put share. Can everyone see our Taylor Plan website the Partners has? Thank you. Thank you for those nods. I appreciate that. I just wanted to share this with you because it's a great clearinghouse for you all as community stakeholders, but also to share with members or your clients or whatever you refer to person serve that you work with, that they're aware of just Taylor Plan, what's available to them. As mentioned earlier, we're going to be sending out constant communication because we know that as we roll out Taylor Plan, there are going to be questions. There are going to be some opportunities to really address some areas that may not be as clear and address any gaps that may come up. So this is going to be one of the resources folks can go to get information, and be looking for your inboxes. We'll be sending more information about various things that we've discovered along the way and giving information that you would help us to direct people to either our member services recipient services line or partners in general. We'll be able to to address any gaps and not have anyone have any drop off in their physical health services. But again, this website really gets into talking about its various places where folks can look at to get more information from the members' perspective from recipients. We're also, one of the things that we've put in line, we have pharmacy. We'll partnering with CVS Healthcare to CVS Health to be our pharmacy benefit manager. I had to get that rolled out. But CVS Health, we work with them, and they have an expansive network across not only the state, but across the country. So we've been interacting with them and partnering with them. We also, you've probably seen information about our nurse line that's up and going. We'll have access to nurses. So a member calls in and has a question, they can call our line that I think you can get through I used to call it the Hope line, the 888-235-4673, and they'll be able then to talk to a nurse, follow the prompts, get to a nurse, and he or she can help them to address what are those issues and give them guidance and direction for them for the physical health pieces. And also for providers, again, as I mentioned, we have our behavioral health providers, and probably some of you are on here, so thank you for attending. But also for physical health providers, such as we talked about with Contegra and the other FQHCs, but other health systems that we're working with, they can have information, and we're reaching out to them. So our whole overall goal is to really embody what Partners' mission is, and that's improving lives and strengthening communities. And this is a great opportunity to do that and do it in a way that is collaborative. We feel our approach at Partners that we have a community model where we really work with the various community stakeholders, along with the members and families and others, to see how we can address the overall health, to be holistic in our approach, but do that from a community perspective that allows us to build off the strengths of our overall community as we start to really help members who are now Medicaid members who are Taylor Plan recipients. But one thing I'll mention is a little advertisement. I mentioned earlier about some of the holistic things we're doing. We're really moving along with just looking at people are sick or not feeling well, having health issues, but also how do we get into prevention more? How do we look at ways to be preventive in our approach? And one of the things that we've done is we're very focused on health education. Again, you'll see Amani. Amani is a certified health education specialist, and we're excited to have her on our team. And she has provided various trainings on various health-related issues that work with our members who we know may have some very significant issues such as hypertension, diabetes. She's done some trainings already on maternal care. I won't step on anything she may want to share, but we're just really looking at how we can be more proactive in our response to working with our members who have health issues, similar to what we've done on the behavioral health side with some of the trainings we offer, such as question, persuade, and refer, suicide prevention training, mental health first aid, CRIM, all those trainings. We want to bring the same training opportunities to our members so they can be able to reach out to those and be empowered with education that'll help them to hopefully avoid them, work that they can have a level of well-being will be in place, and we're partnering with them so they can control their overall health. So those are the kind of key things I wanted to share with the group this morning. I'll more than willing to try to answer any questions that you all may have.
Hey, Jackie, I may have missed it. What's the age range for tailored care plans? Is it for adults or it goes through minors, adolescents as well?
Yes, yes, and yes. We'll be serving individuals, and my team members correct me on this. Our typically is 3 to seniors and to that period. So it's for adult children and adults. That's the exciting part of that, is we're really to make an impact. That's why when we talk about children, our partnership with the local school districts is so important. Ben talked about Contegra, what they're doing here in Forsyth County with Winston-Salem Forsyth County schools. They're in our network, and we're really working with them to address some issues. And they've done something, and Ben, pardon for me, I don't mean to get in your lane here, but just to share a piece. One thing that they've been able to do is also for the kids that are at some of the school-based clinic sites that they're in, I forget the number, is 4 or 5 now. They've also opened up for staff, teachers, because they feel I need you to have teachers who can't get away if they have a very minor, if you will, sinus infection, those type of things, and they can't get away to their doctor because they have to be in the classroom. They've opened it up so staff can now walk down the hallway if they're at one of those sites, and they too can take advantage of those services. So yeah, I hope I answered your question about who we serve. Great question, thank you.
And there's a question in the chat about Contegra doing tailored plan management. As far as I know, we're not doing management like Partners manages, like the Medicaid LME Like I don't believe we're doing any kind of management like that. I also don't have a lot of information about tailored plans. As far as us managing it goes, we will probably just be accepting patients who have a tailored plan for our behavioral health services. But that would most likely be like at our standalone behavioral health office for patients that have higher needs that would have a tailored plan. So I don't know that I would see it that often here in primary care.
Then I think you're right. You take, for example, your Moxville site. They do a lot of behavioral health work there too. And other sites, I think they made physical health. So that's the great thing about tailored plan. Hopefully for the member, it won't really change a whole lot. If they're a tailored plan Medicaid member, we've been really working to push a mandate state says that if a person has a primary care physician, that they'll keep those if they're on a tailored plan. If for some reason their provider hasn't signed up yet, we'll honor that for a period of time. I think it's up to a year. We'll continue to honor that and pay them. So again, hopefully it's making it as seamless as possible. But as you're right, to the care management piece, there's some providers that are care management providers but then also Partners has quite a few that they do that also. And so, yeah, great question. And thanks, Ben, for catching that in the chat. I didn't see that. Other question.
So I have a question. This is Lakin and Yadkin. Let's say that I have traditionally been on the prepaid health plans, but then I go to my doctor and I receive a diagnosis for a mental health condition. When would I be notified that I have been put into the tailored plans?
Great question. Hope I'm going to lean on my partner's colleagues here on this one. This is a good question. I know the process is we're working on making that transition so this person can then be added to. And again, hopefully simply your provider would be aware of us and transition them to contact Partners, or the state has a ombudsman program, and there's a line cert, and they can contact that and they can be connected with that. And as always, hopefully they can reach out to Partners and we'll work them through that. We had a lot of calls from standard plans. People don't know. They think they think that we somehow are their plan manager when we're not, but we work with the standard plans to help that. Hopefully the standard plan too reach out to us and let us know. But I'm gonna stop and before I step too far out there and see what my partners, team members, their thoughts are about that question.
You're fine. I'm just asking, I guess for our clinical perspective, for the health department perspective, to know if we were to encounter a patient, then how would we proceed with it? Like, would they already know that they've been transitioned into the tailored plan, or would we only find out once billing has proceeded? That makes sense.
Yes, I see my teammate Cindy Troball. She's gonna save me on this one. Cindy.
Hey everybody, I'm sorry I'm not on camera today. I'm Cindy Trobaugh with member engagement, and Medicaid determines which plan people are going to be in. Back starting probably in March, the North Carolina Enrollment Brokers Office began sending out letters to people, letting them know which plan they were going to be in. So if they were going to be transitioned to the tailored plan, they would have gotten a letter from the state. Also, just recently, Partners has mailed out, we have just completed all of our mailings in the between May and June out to folks who have been identified who are going to be in the tailored plan. And all of those folks have received a welcome packet from Partners, letting them know they're going to be in the tailored plan. And also it includes their new ID card. It's a new looking Medicaid card for folks who are going to be in the tailored plan. Their Medicaid card looks different now. So folks at Medicaid Direct have the old card that's kind of, I think it's gray and it's about half of a sheet of paper or a third of a sheet of paper. It's kind of large. This new ID card is going to clearly have partners written on the top of it. It's going to be a small wallet-sized card about the size of a credit card. It's paper, hard paper. It's not plastic, but they'll be able to identify by just seeing what their new card looks like too. Anybody that's in a tailored plan or in a standard plan, it will clearly have the name of the plan at the top of the card. So that's another way that you can help people identify which plan they're in. And for anybody that has access to NC Tracks, into the providers that look up folks, you can determine which plan someone's in through that system as well. I hope that answers the question. Different ways that you've gotten mailings, their card will look different. It'll say the name of the plan on there. And so folks should start to know what plan they're in.
So will there be an automatic, I guess, move over, I guess, for lack of a better term, once that diagnosis takes place to the tailored plan, or is there a delay? I guess is what I'm getting at.
Yes, the system will change everybody that's been identified to be in the tailored plan over to the tailored plan for July 1st. I hope that answers that question. You mentioned something about a diagnosis. So the folks who have a greater need that may have more intense needs or have received services that qualify to be in the tailored plan, those are the folks who are going to be moved over to the tailored plan. The majority of Medicaid recipients in North Carolina are served by the standard plan because those individuals don't have as many chronic or complex needs. There's those folks who have that chronic or complex need in behavioral health and co-occurring mental physical health. Those are the folks who will be moved over to tailored plan. And then there are a great number of people who will stay with Medicaid Direct as well.
Hi, this is Latrenda. When I was notified about the tailored plan, well, not really notified, I was talking to his insurance company and I was letting them know like he's lacking a lot of services and what would be the better option for him to get services he need as an individual with intellectual disabilities, and they suggested the tailored plan. When I received the tailored plan, like Mr. Jackie was stating, it lost his access to have medical transportation. My son was recently diagnosed in January of this year with schizophrenia, and for him to get on a bus is outrageous. So I've been taking him to all his medical appointments in an Uber or a Lyft. And that's becoming like really costly because sometimes you have appointments 3 times out the week, sometimes it may be one, it all just depends. And that's the most important thing that I miss about him just being on Medicaid with the Blue Cross. The Teller plan, I'm still learning it and trying to figure out because I really don't see too much right now as of what it directly doing for him because being diagnosed with schizophrenia, it just, I don't know. I'm trying to understand it all. It's very confusing and it's becoming frustrating.
Well, Ms. Dixon, let me first say, I'm sorry to hear that it's been a little frustrating for you. One thing that may hopefully add, that will help is on Monday, we actually start operating a tailored plan. Right now, we've been in preparation phase, and so we'll start on Monday. And with that, the non-emergency medical transportation also comes into play on Monday. People can call now our number and make reservations for it, but it doesn't start until then. That's the date. The state is kind of set to move on. But let me see, if you would, I'm gonna ask my team members, if we can get you, maybe reach out to you offline and kind of see a situation and see how we can kind of help you. Because I know this is going to be a process for you and other parents where they're trying to transition over to this the tailored plan, they may have been with the standard plan transitioning over and have questions, we'd love to, if we can somehow, if someone could put in the chat, email address or a phone number that you can call or you can email to, and we'll reach out to you and try to talk you through to the situation, see how we can help.
Thank you.
You're more than welcome. Thank you for making us aware of that. Because that's one thing, again, why these meetings are a great opportunity for us to be able to kind of hear what the concerns, the issues are, and be able to address them as soon as we hear them. So thank you for bringing it to us, Ms. Dixon. We'll make sure to that you again get information to you.
Hey, if I can add on that too, my name is Nicolette Adams. I'm with the North Carolina Medicaid Ombudsman. You definitely should be getting medical transportation, even if your son is currently just in the Medicaid Direct. And that would be through the county. If he's in that Medicaid Direct plan, you would just call your local county social services to get that. But of course, since he's about to transition to the tailored plan, that transportation will take effect July 1st. But yeah, you definitely should not be having to stress with that. That benefit is definitely available to your son. So I put our number in the chat. If you want to call us, we have a really good team who can help kind of navigate that whole system and get you where you need to go.
Thank you, Nicolette. And just throwing out something there, Nicolette will actually be presenting at an upcoming community collaborative we'll be having. So great to have her as part of the team here to support the people we serve. Cindy, I see your hand.
I just wanted to mention that I put the number to our member and recipient services line and to Motive Care in the chat in regard to the non-emergency medical transportation through the tailored plan. I'm not sure if you all could see that, but I just want to put those numbers out there as well. Thank you. It looks like Peg, do you have your hand up?
Yes. I was not finding the button to put the digital hand up. My question is, I think it's a no-brainer, but we've never used the medical transportation service. It seems like it would be obvious. Does it also include a companion for the person to go to the medical appointment with them? I mean, it seems like for an intellectually disabled person, there's a moot point to have transportation if it doesn't include their guardian to go with them.
Yes, they can have a companion to ride with them. And minors as well, but yes, someone right.
Yeah, thank you.
Thank you so much. Are there any last questions? I'm trying to look through to see if there's anything coming up. There is one. Can transportation be individualized versus communal if medically necessary?
I'm going to jump out there and answer this. If you call the transportation line and explain the need, they will work with you as best they can. It is based on need, and it is based on what's available in the area. So it really, it's going to be on an individual basis, but they will determine the type or mode of transportation based on those two things, the need of the person plus what's available in their local area. Now, I also want to mention, and I know we're past time, but I do want to mention too, that in addition to transportation, you can also inquire about transportation reimbursement. If you have someone that can help you get there, and they want to, get that approved in advance, maybe it's possible to reimburse them for their mileage or any type of parking fees or tolls along the way, or even if it's a long distance ride, sometimes you have to stop to get a meal. So there are certain circumstances under this non-emergency medical transportation where you can work with them if their ride is not going to work and you have a way to get there, you can talk to them about transportation reimbursement. So be sure to ask about that as well.
Thank you so much, Cindy. Before we close, I did want to note, Jackie brought up our partners webpage. I encourage you to check that out. There are a lot of really important links to the community and to the members that we serve in the community, as well as you can access a variety of different trainings that Partners offers to the community as well, to support you and the members that we serve. So please check those out. With that, I'm going to turn it over to Amani and talk about what's coming up.
Thanks, Jerry, and thank you everyone for attending. Please, before we close, just take note of the links and the resources and information in the chat. Next month, our topic will be Mind and Body. You are what you eat. And that will be July 24th at 10 a.m. So we hope to see all of you. Thank you.